Outpatient Clinical Practices. We're so glad that you could join us for a brief discussion on the CMS Quality Improvement Program. We're going to try to be brief. We know your time is limited, and we really just appreciate you spending a little bit of that with us today. Before we get started, I just want to acknowledge that we will be recording this session, share it with individuals who enrolled, but were not able to make it for some or all of the session. Next slide, please. Before we jump into the content, we really would like this to be an interactive session. Also, just if you are not hearing one of the speakers, myself or another speaker, or not seeing slides, please let us know, and you can do that via chat. An important note with WebEx, when you go to chat, you want to make sure to select everyone, and you can do that in the chat panel by scrolling down and selecting everyone. Otherwise, it just goes to the panelist. And why don't we do that now? And just tell us a little bit about yourself. Test it out, make sure that it works and that we can see what you're chatting in. Tell us your name, your role, your organization, and state. And while you do that, we are going to move on to the next slide. So the Mid-Atlantic CMS QIN-QIO team brings together a group of healthcare professionals, including physicians, nurses, pharmacists, social workers, measurement experts, and more. Collectively, we bring real-world experience in healthcare delivery, but also significant experience working with healthcare providers like yourselves and helping them achieve their quality goals. You'll hear more from my colleagues, Joanne and Anne, who will share practical insights and strategies that our team can help support for your organization's goals. And my colleague, Kayleese, will be monitoring chat to make sure that we're on track and that we're answering questions that you might have. Next slide, please. So in the next 27 minutes or so, we're going to talk a little bit about CMS quality priorities, how the QIO program actually can support the merit-based incentive payment, or MIPS, success under the quality payment program. My colleague Joanne will share more about that. Practical ways to improve and increase screenings, chronic disease management, and preventative care, and also strategies to build partnerships that close gaps and improve outcomes. Next slide, please. So the Mid-Atlantic CMS QIN-QIO is a collection of the providers in Delaware, District of Columbia, Maryland, Pennsylvania, West Virginia, and Virginia. And collectively, you care for over 7.5 million Medicare beneficiaries. So when you join the QIN-QIO, you're joining a regional learning collaborative and a great opportunity to connect with others who are struggling with the same areas that you may be struggling with. Next slide. So over the next 5 years, the CMS Quality Improvement Program through Mid-Atlantic CMS QIN-QIO will help outpatient practices improve care across prevention and management of chronic conditions, patient safety, behavioral health, and care coordination. We provide practical, just-in-time support and guidance to strengthen your quality management and improve patient outcome. And you'll hear more about that from my colleague Anne shortly. Next slide. For those of you who are familiar with the CMS's Quality Improvement Program, this round is a little bit different. CMS has identified providers, hospitals, nursing homes, and outpatient clinical practices who are eligible to participate in the program. They did that by identifying providers who were small, in rural areas, supported an underserved population, or who had submitted data to CMS that showed an opportunity for improvement and support. Next slide, please. For those eligible providers who enroll, we take a really customized support approach. First, we focus on what matters to you and align our approach to ensure that we're supporting that first and foremost. We provide custom data dashboards. We also provide tailored assistance and make community connections. So it's not just within the four walls of the particular provider, but also creating connections with other providers across the continuum, including community-based organizations. And importantly, as the QIO, we can bring together providers from across these 6 areas for collaborative learning opportunities. Next slide, please. Just want to pause before we jump into the meat of the presentation and see if there are any questions. Please, any questions in chat?
No questions in chat at this time.
Thanks, Kaylee. We've talked to a lot of providers over the last couple of months, and some of the questions that we get that you may be wondering and worth sort of circling back on. One was, how was I identified? And again, CMS identified providers based on their size, where they're located, the population they serve, and the data that has been submitted to CMS that may have shown an opportunity for improvement. Another question is, how much time will this take? And the important thing is that's really up to you. We're here to support your needs, and that can be as much time or as little time as makes sense for you. Another one that we've been getting a lot lately is, wow, this covers a lot of area. Do I have to work on everything? And the answer is no. CMS has identified for each provider primary areas that could be of focus. And we'll work with you to identify whether those are areas of focus for you, as well as other areas that may be areas that you want to personally work on to address. One thing that's important is this is, although it's a 5-year contract, we review and evaluate your goals at least on an annual basis, and we update a quality plan based on that. So again, this is really customized to what you want, the level of support that you need. Our team is here to support that and whatever that means for you. I think that's probably it, but if another question comes to mind that we haven't addressed, please feel free to put it in chat. We'll do our best to answer that. And for now, I'm going to turn it over to my colleague, Joanne, and go to the next slide.
And can you go to the next slide? The one after this? Thank you so much. So good afternoon, everyone. My name is Joanne Vanderpool. I'm a Senior Quality Improvement Advisor with iPro. I've been with iPro for about 17 years, working closely with outpatient practices on initiatives such as MIPS, EHR integration, patient-centered medical home transformation. And I'm truly excited to be part of this new scope of work and to help you connect MIPS efforts to the statement of work. So during the 12 scope of work, iPro collaborated with many outpatient practices on MIPS implementation. That experience was incredible because it allowed us to really support practices in several important ways. We were able to help them understand and attest to MIPS requirements under the QPP. We help them improve workflows in key categories such as promoting interoperability and improvement activities. And we also helped MIPS participation in practice transformations models such as patient-centered medical home. And we also help them align reporting with clinical priorities so that providers can meet MIPS requirements while also advancing their own quality goals. So now we're entering the 13th scope of work. And this foundation is very important because it enables us to clearly demonstrate how the QIN-QIO's free technical assistance continues to support outpatient practices in both their MIPS reporting and the overall quality improvement strategies. So let's take a look at the 4 MIPS performance categories that make up your overall score. The first is quality, and quality is usually the largest of the MIPS categories, and it's the most heavily weighed for all practices. Then we have promoting interoperability. There's an emphasis that it uses really the certified EHR technology, which includes e-prescribing, secure messaging, patient portal access, and health information exchange. Then we have improvement activities, and CMS rewards practices for implementing evidence-based quality improvement efforts at the practice level. And the last category is cost. And this is based on Medicare claims data. So providers do not submit to CMS on the cost category. CMS will analyze claims to evaluate resource use and efficiency. So each of these performance categories is aligned with the goals of the 13th statement of work, whether it's false prevention, infection control, care coordination, or chronic disease management. Together, they reflect a commitment to high quality, patient centered care that incorporates patient engagement, effective use of health IT, continuous improvement, and cost management. Ultimately, MIPS serves as a framework to adjust your Medicare Part B payments based on performance in these 4 categories. So our goal is to really encourage providers to report and make sure that they're providing high value and patient focused care. Next slide. So in the previous slide, we reviewed the 4 MIPS performance categories, which were quality, improvement activities, promoting interoperability, and cost. Now, it's important to highlight that these categories are not standalone. They are directly supported and reinforced through this initiative. The initiative has been intentionally designed to align with MIPS, offering your organization a unique opportunity to improve performance while receiving the no-cost technical assistance. So let's take a look at the quality measures. Our team helps providers track and improve outcomes on key clinical measures such as hypertension control, diabetes management, infection prevention, falls reduction, safe care transitions. These measures are commonly tied to MIPS reporting requirements, so improvement here directly supports higher MIPS quality score. We also will help you with the promoting interoperability. We support practices in maximizing the use of the certified EHR technology, including patient engagement tools, electronic prescribing, and HIE. These activities enhance your PI performance and also align with the scope of work with the emphasis on leveraging health IT for better outcomes. Let's take a look at improvement activities. Participating in a QIN-QIO-led initiative counts towards MIPS IA credit. This includes care coordination, patient safety projects, chronic condition and behavioral health management, health equity, and workforce development efforts. This allows providers to receive recognition and credit for quality improvement work already in progress. The last category, which is cost, our focus is on reducing avoidable hospitalization, emergency department utilization, adverse drug events, and support cost efficiency and contributes to improved performance in the cost category, even though this is calculated from your Medicare claim and not submitted directly to CMS. So by engaging in the QIN-QIO 13 scope of work, your organization is not only enhancing patient outcomes and advancing public health, but you're also strengthening your MIPS performance. You're also making sure you're boosting your scoring potential and you're positioning for a more favorable Medicare payment adjustment. Next slide. Now that we've covered the 4 MIPS categories, I really want to take a moment to highlight how these categories align with the work being done under the scope of work. One of the most important things to understand is that these aren't separate or competing efforts. In fact, they're deeply connected. The MIPS and the 13 scope of work crosswalk provides a clear picture of how the priorities set by CMS under the QIN-QIO contract directly align with the requirements that practices are already working to meet under the QPP. So by mapping each MIPS category to the corresponding aims and sub-aims within the 13 scope, we can show that the same activities that you're already doing for MIPS reporting are also supporting your overall quality goals. So let me give you a few examples. So under the quality category, for example, initiatives like chronic disease prevention, patient safety, and safe care transitions are all part of the 13 scope, and they directly support the MIPS clinical quality measures. In the area of improvement activities, your work in care coordination, population health, behavioral health, and patient engagement doesn't just improve outcome, it can also count towards your MIPS IA credit. So when you participate in the scope of work, this is not additional work. It's a strategic opportunity that helps your organization meet the MIPS requirements. It helps you improve patient outcome, and most importantly, it helps you avoid the negative payment adjustments. This alignment allows you to get more value out of the work you're already doing while positioning your practice for long-term success under the QPP. Next slide. This slide builds on the previous one. What we continue to really highlight is the crosswalk between the two, how the work you're already doing to meet MIPS is directly supported by the goals and activities laid out in the scope of work. So instead of seeing this as a separate track, the crosswalk really helps connect the dots. It shows that your participation in the 13 scope is not additional work. It's actually smart, strategic way to use the free technical assistance. It helps strengthen your MIPS performance, improve your outcomes, and as we said, avoid the negative payment adjustment. So in short, it's about working smarter, not harder, and leveraging support that's already available to help you meet your goals under both MIPS and under this scope of work. Next slide. So as we move into the final quarter of the MIPS performance year, there's still valuable opportunities for providers to strengthen their MIPS performance and avoid the negative payment adjustment. This is where partnering with the Mid-Atlantic CMS QIN-QIO under the 13th scope can make a big difference. Your organization can receive direct, no-cost support to review your progress across all 4 of your MIPS performance categories. We can identify areas where quick, meaningful improvements can be made before the year ends. So, for example, our team can help ensure that important quality measures such as hypertension control, diabetes management, infection prevention, and care transitions are being properly tracked and submitted. We can also assist and review your promoted interoperability activities within your EHR, making sure components like patient portal use, e-prescribing, and health information exchange are all in place and accurately documented. When it comes to your improvement activities, we can confirm that your efforts in patient safety, care coordination, and chronic disease management, many which align directly with the scope, are fully documented and eligible for credit. And for practices experiencing exceptional circumstances, such as staffing shortages or operational challenges, we can guide you through the process of submitting the CMS hardship exception application, which can help prevent a negative payment adjustment. So why engage now? Because connected with the QIN-QIO at this stage of the year doesn't just protect you from penalties, it also allows you to maximize your MIPS score. It helps you align your efforts with national quality priorities, and you'll close out the performance year with a clearer path and improved outcomes. We really want you to close it out with a great finish. So before I turn the presentation over to Anne, some of you may be wondering, what about outpatient providers who aren't eligible to report under MIPS? For example, if you're part of an ACO, or if you don't meet the patient threshold as well as the Medicare dollar threshold. Even if your practice doesn't participate in MIPS, you can still participate in the statement of work. Our assistance isn't limited to just MIPS. The QIN-QIO is here to help all outpatient practices improve care quality, enhance patient safety, and strengthen health outcomes, regardless of your reporting status. So with that, I will turn it over to Anne.
Joanne. Next slide, please. Oh, next slide. I'm Anne. Hello, I'm Anne Merca, and I'm a pharmacist and senior director on our team, and I'll be sharing our areas of clinical and foundational focus and some supporting strategies. Our first focus is on disease prevention and management of chronic conditions. We aim to optimize adult immunization status to reduce the incidence of preventable illnesses. We are committed to supporting practices with managing hypertension, type 2 diabetes, and chronic kidney disease. Improving access to and the quality of behavioral health care is essential. Our efforts include enhancing support for practices regarding screening and management of depression, suicide risk, and substance use disorders. We also strive to spread chronic pain management best practices, including the use of opioid and non-opioid treatments, making sure patients receive appropriate and compassionate care. Patient safety remains a top priority. We're working to reduce adverse drug events with particular attention to opioids, anticoagulants, and diabetes medications. Additionally, we'll support implementation of comprehensive risk assessments and care planning to prevent falls in the outpatient setting. We'll work with you and your community to strengthen care coordination, to reduce hospital readmissions and emergency department visits. By improving transitions of care and fostering communication among providers, we aim to ensure that our patients receive consistent, high-quality care throughout their healthcare journey. Next slide, please. So our general approach is to provide tiered technical assistance, which is focused on your priorities. You'll work with our quality improvement advisors to develop tactics that are data-driven and aligned to SMART goals. One of our most important and popular services is to provide aggregated comparative peer benchmarking. This is de-identified data that allows you to see your performance against other similar practices as you progress through an improvement activity. Once your needs are determined, we may engage with you through affinity groups to share evidence-based resources and best practices. We strive to help implement workflow improvements that move the quality needle while reducing workforce burden. For example, assistance in optimizing the use of your EHR for reporting, coding opportunities, order sets, and clinical decision support utilization. Next slide, please. The slide has a lot on it. It's for your reference after the webinar, but it shows an overview of the clinical areas of focus and some proposed approaches that can be customized for your needs. I won't review everything, but examples are harnessing the full capabilities of your EHR, as I said before, also including interoperability, patient-centered initiatives for self-management, trainings and education, including access to subject matter experts, and enhanced communication across care settings. Next slide, please. CMS's quality improvement organizations are also supporting providers across several operational focus areas that directly impact care quality, patient safety, and organizational resilience. We'll help providers and outpatient practices build strong evidence-based quality management systems. The goal is to ensure that services and systems consistently meet performance expectations and that quality and safety are always front of mind for leadership teams. We support providers in developing and maintaining comprehensive emergency preparedness plans. This includes ensuring plans are complete, up to date, and that organizations conduct regular drills to identify and close any gaps. We also lead a regional emergency exercise fully compliant with the National Homeland Security Exercise and Evaluation Program, followed by an after-action report to capture lessons learned and strengthen future readiness. Workforce planning is a major concern across care settings. We offer technical assistance to evaluate the impact of staffing strategies on patient care and quality outcomes. In supply chain management, we help facilities identify supply chain risks, access necessary resources, and create contingency plans to ensure uninterrupted care delivery. This includes managing essential supplies, equipment, and patient services, particularly during emergencies or shortages. Drug shortages remain a serious issue across healthcare settings. We assist providers in building efficient processes to track, prevent, and respond to shortages. This includes establishing local coalitions, creating contingency plans, and minimizing disruptions to patient care. We also provide access to 2 pharmacist subject matter experts for technical guidance and resource support, me being one of them. We conduct cybersecurity vulnerability assessments to help providers identify risks like outdated software, weak access controls, or limited staff training. We then connect them with resources for mitigation, including tools, training, and updated security practices. We also help integrate cybersecurity into emergency preparedness plans. That means ensuring all emergency plans explicitly address cyber threats like ransomware and data breaches, enhancing provider resilience against both digital and physical disruptions. So now I will hand the presentation off to Lynn. Thank you.
Thanks, Anne. Next slide, please. Next slide. Thanks. As we begin the important work, you met a couple of our regional support team members who lead areas of work. We also wanted to introduce you to our regional state leads. These are individuals who are the primary points of contact for the QI work and will be a great source of support to you and your teams. Next slide, please. I want to again thank you. I know your time is limited, and we appreciate you spending a little bit of your lunch break with us today. We hope we answered some of the questions that you may have, and that you're interested in joining and participating in CMS's quality improvement program. In terms of next steps, we would encourage a couple of things. One, to reach out either to the state lead for your area, or email us at QIN-QIO-R2@ipro.org and set up a one-on-one conversation to talk about what your quality priorities are. As you heard Joanne, we can help you navigate the quality payment program, and you heard from Anne about the various clinical areas that we can help support. All of that's great, but we want to support what matters to you. So understanding what your priorities are is really helpful in our ability to do that. We also would encourage you to encourage local hospitals and nursing homes to participate in the QIO program. When all providers within a community are focused on quality improvement, the outcomes are enhanced for everybody who lives and works in that particular area. QIO quality improvement is a team sport, and we want to make sure that we have everybody on board. Again, we want to thank you for your time and attention. Please don't hesitate to reach out. We want to know how we can best help support your quality goals and look forward to doing that in the near future. Thanks so much, everyone. We hope you have a wonderful day.